Hello, everybody. All right, we are on live number 4 for my health history. I think it's kind of sad, the idea that I have 4 times to talk to you about my health history. I'm 50. I'm totally transparent with lots of information. Obviously, I wouldn't be talking to you about this stuff. But as a 50-year-old, I think I should not have as much of a significant health history that's led me to where I'm at. But nonetheless, here it is. So, high-level recap. Just from the last video, again, if you have no idea what I'm even talking about, there's 3 other videos that kind of go into a little bit of detail about what's been going on in my body health-wise over the course of the last, well, let's see, until we get to this point, probably 45 years. So, I had just recently come off of 4 surgical procedures. One was a hysterectomy, one was hardware removal out of a spinal fusion in my back. Another one was a hip surgery in order to fix a bunch of tears that were there, as well as a laparoscopic surgery into my gut that showed I had an ovary stuck on part of my bowel wall. Weird things, less than 2 years, all those surgeries. That's kind of a significant stressor. Every surgery in itself is a stressor on the body, in addition to all the antibiotics and all the other things that they're doing for this. Not to mention a lot of pain that I was going through in that 2-year process. All right, so at this point, I've kind of made some decisions to leave administration. Again, that stress level for that job was just not happening for me. I didn't want to do it anymore, and I thought, you know what, let's just go right back to the bedside. So I went back to being a bedside nurse, working in a neonatal intensive care unit. That's what I knew, what I loved. And what was interesting about it, I also made the decision to go be an adjunct nursing instructor at a couple of colleges in the cities. So I was dabbling in education. I've always loved education, and so I took that as an opportunity to say, all right, let's go teach at the college level. Loved it. Started having a great time. Reason why I say this is I was on the go, and I wasn't sleeping very well. Go figure, huh? So back to that idea of not sleeping well. Then the joint pain started. So I don't know how many of you have managed joint pain. At first for me, it started with just a little bit of swelling in my fingers, and they were stiff in the mornings, and then my wrists, they kind of got a little achy, and I just kind of blew it off. Who knows why that was happening? I didn't really care. I just was like, just pop some ibuprofen, because ibuprofen is the collect-all be-all that helps everybody with all their pain, right? So proceeded to just kind of fast forward. The joint pain started getting progressively worse. But what was weird about it is it would come and go in different places in my body. And so sometimes it was my hands, and then it was my wrists, and then I'd get real achy in my elbows, and then even in my shoulders on occasion, down to my toes. My toes would ache, and they'd look like little sausages. So it just didn't have a rhyme or reason to it. The pattern would be sometimes it was there, sometimes it wasn't. It really just made no sense to me. So I started talking about it with my doctor. At the same time, I started looking and doing some research. I'm like, there's got to be something I can do out here. And I had heard about elimination diets. So I started doing some elimination diets where you stop eating certain things that might be inflammatory. And so I did that for a little while, but I never could hone in on it. I actually sought out the help of a nutritionist that did some testing on me that told me I had a bunch of different foods I was reactive. So I pulled all of the reactive stuff out of my diet, and it still didn't help. And I'm like, well, this is really weird. All right. In the meanwhile, I'm getting more sore, more swollen, and this is starting to be all the time. It wasn't even a break anymore. So adding in the idea, I'm trying to do everything, the teaching, the working, the not sleeping, I'm really getting sore. In addition, I'm really getting crabby. I don't know about you guys, but when you start getting into pain all the time that does not let up, that crabby factor really got big on me. And it was impacting my life with other people. So they were able to see it, and they knew I was, just avoid me because I was not a good person to be around. I started working with my doctor on trying to manage and trying to control this. And we started, very conservatively and looking at, okay, well, let's just look at maybe some high-powered ibuprofen type drugs. So we did those for a while. We even went into narcotics. They didn't do a darn thing. And so he started making the decision to say, you know what, let's start thinking about rheumatology. Okay, well, at this point, I am in so much pain. I'm going to work, and I'm starting to become afraid of what's going on. So I started watching how I was working. Was I able to take care of the babies appropriately was the big question. And at this point, I was still okay. I just hurt. So I meet my first rheumatologist who does all of this big workup, tons of x-rays, tons of labs. I mean, so many different labs. And all of everything came back normal. Sound like a lot of you? Everything's normal, yet I'm in so much pain. What on earth is going on? Now, his mind was, it's rheumatology. You have something called seronegative rheumatoid arthritis. What does that mean? It means your labs are all normal, but we don't know what's wrong, so let's just give you arthritis medications. So I'm desperate. I'm at this spot now. I am hurting so bad, and I'm starting to get overly exhausted, and you already know the crabbies are in. So I'm like, let's do whatever. I'm in. So he's like, okay, I'm going to give you a medication. It's very mild. It's a starter point for dealing with arthritis. Don't worry about it. Nothing's going to go wrong. I'm like, all right, sounds great. So I take this medication. Within 2 days, I started rashing. What does that mean? I had rash from the top of my head to the bottom of my toes, all over everywhere. It was raised. It was red. It itched so bad, and it burned in the shower. What the heaven's name happened to me? So I contact this doctor and I said, I've got a really big problem. And he said, no, it's not supposed to happen like that. You don't rash out like that on this medication. And I said, well, this is the only new thing in my life. I don't know what's going on. All I know is I have a big problem. And he proceeded to say, no, you don't. So he was arguing with me, and I didn't know what else to do. So I'm like, he's like, well, let's just try some steroids. And I'm like, I'm not taking this medication. I'm done. So I started on high-dose steroids. Now, if you don't know what a steroid is a medication that suppresses your immune system or stops it and slows it down so the response isn't so bad. I was on high-dose steroids for over 2 months before that rash started to go away. That's a problem. I'm still working in the NICU, or the neonatal intensive care unit, and I need to have my skin exposed in order to take care of these babies. Not a pretty situation. So we get to a spot where the pain is getting worse. The steroids aren't really working for the pain. In fact, I don't know, things were just getting really bad, and I was getting really crabby and really not sleeping. We decided that it was a really good thing to start another medication that's actually used as a chemotherapy drug. Okay, so chemotherapy, that is, you've heard for cancer, but you can use those types of drugs in order to kind of help suppress immune systems, which is what we were going to do. We knew there was something wrong. We just didn't know what it was. So let's just give you medication to get rid of it. Okay, I took that. I did not feel good. I felt sicker. In fact, my joint pain got worse. And I'm like, okay, this isn't working. Well, one of the solutions was, let's just double it and make it stronger, because that maybe will push through it on the other side. Okay, I'm in. I don't know what else to do. And so I started doing that, which proceeded to get me sicker. This was also the same time that I was holding babies at work and started to realize that I actually was afraid that I couldn't care for them properly. I would try to put an IV in their arm. Sometimes that's something we had to do, or I would have to use my fingers to do different types of things with these babies in order to help them. And what would happen is I couldn't do it. It was when I almost dropped a baby a couple different times that I went, I need to make a change. I hurt that bad. I do not have control over my hands anymore, to the point where I'm afraid I'm going to hurt somebody. We need to make a change. So I made the decision to change that career path, and I went back into administration. And so I worked in the hospital system in administration, and I was still teaching. The medication still wasn't working. So I spoke with this provider, and I just said, something's not right. I know there's something wrong in my body. I don't know what it is. Please help me. What is going on? And he's like, everything seems fine. And I'm like, okay, you're not hearing me. And I said, I'm really wondering if I'm crazy. Have you ever heard that? Have you ever thought that you're having all of these symptoms and no one hears you, and you are desperate to try to find an answer or a solution, because again, way up here for many months with this pain, nothing's working. And he told me, his response was, well, I have people that I can send you for that. Would you like a psychiatry recommendation? And I looked at him and I just busted out into tears, because I didn't know what else to do. I'm watching and I have no idea what else to do. So I proceed to fire him. And you can do that with your doctors. Did you know that? You can actually fire your doctors. So I ended up reaching out, and I ended up at a different, a bigger hospital type of situation, and started seeing their rheumatology clinic there. Again, more workup, more labs, more everything. What did I proceed to do then? Well, I started on different medications for arthritis. Again, same type of thought. Let's just give you more medications to try to help you with the joint pain. All right, I tried them. They didn't work. In fact, I got sicker, right? We tried high-dose ibuprofen as a way to relieve pain. That didn't work. It just made my tummy hurt. Again, ramping up on the crabby scale, ramping up on the pain scale, things progressively getting worse. And now I'm starting to become afraid because they're telling me that if we can't get this under control, then I'm going to have disfiguration in my hands. I'm going to have all of these problems, and I'm looking at potentially a future that I can't walk and do things. That's what I'm hearing, and that's terrifying to me. Like, but how do you know this? My labs are normal. I don't understand. So we end up making the decision to try what we call a biologic. A biologic is an injectable medication that you actually inject into your body. And what happens is that suppresses your immune system. And by suppressing your immune system, the theory behind it is you are able to take care of the inflammation in your body. It doesn't get to the root cause. It doesn't tell you what's going on. It just makes it try to go away with the pain. So I tried that. I'm injecting myself once a week, having reactions from that medication as well. And guess what? Didn't work. So now what am I doing? Now at this point, I'm getting really frustrated. I'm getting super sore. I'm turning into psycho crazy lady at work. I've got people coming up to me saying, you are not in a good place. You are not acting like you normally are. You're normally in a great mood. Something's off. What's going on? You know, and I'm like not trying to tell everybody about my medical history for crying outside, but I could barely move. I could barely walk. I could barely use a pencil. So fast forward. There's this really interesting thing that happened in 2020. It's called COVID. COVID hit. And so we were at a place that I was in the middle of getting ready to transfer over to a different rheumatology person. I had had one meeting with them prior to COVID entering into our world. And the decision was we're going to go ahead and start on another biologic. So that's a different type of medication I would be injecting into my body. Again, not because my labs showed that I had anything, but just because they didn't know what else to do with me. So that was happening. When COVID happened, my job, that was high stress anyways, turned into complete bizarro world, right? So try managing a hospital and working with that in the middle of COVID. I went through the roof with my stress level, adding in the idea I wasn't sleeping and I hurt so bad. It created just a disaster. So I could not get in to see my rheumatologist, which was actually a blessing in disguise. I made a decision to leave the acute care world and go teach full time. And with that, I started kind of looking at different alternative things. So maybe like many of you, you're trying to figure out what's going on. Nobody hears me. I just keep taking medications. I get sicker, sicker, sicker. I was listening to a podcast. Again, at that point, you're all in lockdown. And so either I was at work or I was stuck in my home. And I had heard somebody talk about this thing that I thought was really weird because it's something that utilizes nutrition in a way that can tell you maybe what's going on and help you figure out a custom plan for yourself. And I thought, well, this is weird. So I kind of ignored it for a while, but then I kept getting this nudge to just check it out. And I thought, you know what? Why not? Let's just try it. So what did I do? I actually reached out. I started working with a practitioner based out of the state of Florida, if you can believe that. And what was happening is I would have calls with this person every week. And she would be testing my body in a way that I had no idea what she was doing. But all I knew is she was telling me things that blew my mind about what was going on inside my body. And that if I took certain types of supplements, that would actually help my body manage it. So here's the skeptic in me going, all right, is this evidence-based? What's going on? This is nothing medical. I don't want anything to do with it. But again, remember, I was really desperate. I hurt so bad. So I went, you know what? Let's just try it. It started to make a difference. I actually started to feel better. And then as I started instituting some of the lifestyle changes that she recommended specifically for me, I actually shouldn't have been eating grains. I needed to pull them. And so once I finally listened to her, my life changed. My joint pain was gone. My fingers weren't swollen anymore. I didn't hurt. My brain fog was gone. I was not psychotic and crabby. Well, I'm sure I was crabby, don't get me wrong, but I wasn't psychotically crabby like I had been. What I noticed was my life was changing, and I didn't have a good reason for it other than what they were telling me to do. So that totally intrigued me. And that led me down a path of exploration. While I kept trying to navigate my world and do everything I could, I noticed that there were some pretty significant, amazing things going on in my body. So much so that following summer, I started working in that environment. I started researching and getting more education in it, and then made the decision to actually leave my nursing career, to promote and to go into that world full head on. I dove in. And I learned amazing things about the world of holistic health, especially when you focus it on nutrition and how do you utilize the amazing properties of herbs, of homeopathics, of whole food supplementation combined with lifestyle modifications and changes very specific to each individual body in order to make that body start to heal. I have seen amazing things happen in my practice, and I would love to be able to share some of the things I've learned over the years with you. So it's not just about diet. It's not just about supplements. It's actually about so many different things that can factor in, whether it's emotions, whether it's learning how to manage stress, whether it's understanding what can you do to help you sleep, what can you do to help you navigate this world of crazy. There's so many things. You can scroll through Facebook, you can scroll through Instagram, and you can see all of these different things. And how do you even know where to begin and where to start? That's the work that I've been doing over the last 5 years. I figured out what I needed to do for my body with the guidance and the help of other practitioners, helping me determine how to do it, utilizing products, utilizing methods, different types of things to help get my body back on track. So I would love to be able to share more about that and explain it. I have a workshop coming up. It is on April 29th. It is a Tuesday. It's located in River Falls at the Industrial Innovation Center up in the north side of town. I encourage you, I will post a link for you to sign up down in the chat. Again, I would love to be able to help anybody that's got these issues. Life got so bad, I needed to do something different. And that's exactly what I had bring me to my knees, was this joint pain. So with that being said, I'm done with my health history for now. Looking forward to hooking up with you later. We'll do more lives. I'll come up with some more fun stuff to talk about. There's so many different things I'd love to share and teach you. So if you have any suggestions, go ahead and connect with me. Again, you can always reach out to me through the website. And I look forward to walking along beside you in your own health journey. So thanks for listening, and we'll chat later.